So are you seeing my screen? Are you seeing my screen? You're seeing my screen. Mr. Patrick, I wanted to confirm if you're seeing my screen. Yes, please. Are you seeing my screen?
Yes, the screen is visible.
I can't hear you very well. Good evening. And remember, we are dealing with a module called Public Health Nutrition, and we introduced it. We saw how nutrition relates to diseases that we encounter when we are in the communities, but we also saw how to deal with them. So today we are going to look at malnutrition at the level of public health nutrition. We are not going into uh, too much detail of malnutrition, but we shall see a way of dealing with it at public health level. So malnutrition, as we all know, is that condition that can result from eating a diet that is either in excess or deficient of some nutrients that are required for optimal health, and it can affect people of all ages, especially, but it is especially harmful in children, in pregnant women, and then older adults. So we should pay attention to that first definition, although it does the one that I'm showing on the screen hasn't captured what I said, but you should note that malnutrition includes both angles. You're having people who eat the food that is deficient or their body lacks the nutrients that are required by the body, but also those people who are having excess of these nutrients. So all those two will belong to this concept called malnutrition. As you can see here, that overnutrition and undernutrition are all forms of malnutrition and can negatively impact health, as we are going to see. So overnutrition occurs when you take excess of the nutrients that are required by the body, and then undernutrition is that situation where you take insufficient nutrients to meet the body's needs. So the result, of course, in overnutrition, you can have being overweight, being obese, having diabetes due to the consumption of a lot of sugars all and all that, and then cardiovascular diseases like we saw in the other previous session, for example, heart disease, stroke, hypertension, and other chronic conditions, including cancers. Then, under nutrition, when the body is not receiving enough nutrients, you're going to have stunting, whereby you are short for your age. So, you've seen some of those children who are short for their age. They are 10 years, but you cannot really tell. And it's not about maybe their genes. Then wasting, it is more of having less weight compared to your height. Okay, so someone should always be a bit proportional, but if you have less weight compared to your height, then we consider you to be undergoing this condition of wasting. Then we can also have micronutrient deficiencies in the case of undernutrition, and all those micronutrients we have already seen, like zinc, iron, iodine, and the rest that we saw earlier on. Then it also, of course, increases the susceptibility to infections. Okay, so some infections might take advantage of you not eating well to bring you down. Okay, yeah, things like uh, things like flu or influenza, things like if you have like HIV, it could now make it worse if you are not eating well. Okay, so all those are effects of undernutrition. Then malnutrition concepts that we have to talk about for this session include hidden hunger, which is related to lacking the essential micronutrients. Like I had said, they include iron, iodine, vitamin A, zinc. So when those lack in your diet, as we were saying in those previous sessions, that these micronutrients are important in the body, but they are required in small quantities. That's why they are called micronutrients. Like those macronutrients, like proteins, carbohydrates, fats. So these ones, the vitamins and these minerals, are required in small quantities, but are very essential. Things like iron, iodine, zinc, and vitamin A and the other vitamins are very important. Then stunting is another malnutrition concept, like I had said, it is that condition which results from chronic malnutrition and affects physical growth and sometimes even the brain growth or functioning, what we are calling cognitive development. So if someone is having stunting or they are short for their age, their height is really so they are too short for the age that they have, and the condition, as we are saying, is called stunting, could go on to affect more than that physical growth, but also how they function mentally. Okay, so that is why we emphasize such uh, interventions to reduce malnutrition. Then the other concept is wasting, and in this case, it results from acute malnutrition and uh, insufficient food intake, but also it could be as a result of infection, and it can lead to rapid weight loss and then increased risk of dying or mortality. So, like I was saying, wasting is when you compare your height and weight. So if you're too small for your height, then that is what we are calling wasting. It can result from not taking enough food, it can result from having a disease or an infection, and then its effects we have already looked at them. Then the other concepts are more of these conditions. Kwashiorkor and marasmus arise from lacking those essential uh, macronutrients like proteins and carbohydrates, and it is characterized by having edema, muscle wasting, and then sometimes when it is not treated early enough, you can have organ failure from these two conditions, kwashiorkor and marasmus. Then obesity, like we had said, is that form of malnutrition whereby the energy intake exceeds the energy expenditure, and then it causes excess body fat and increased risk of chronic diseases. So when you take more nutrients than what is required by the body will convert this excess into body fat, and when this body fat becomes a lot, it can lead to obesity and then its related evils like diabetes and other chronic diseases, especially those that affect the heart, like heart disease, heart attack, uh, stroke. So the effects of malnutrition, we realize that it can negatively affect public health, such as increased morbidity, which is illness, and then if you're ill and not treated early enough, or if the condition is has gone further and you're not responded to, then you are going to end up dying, which causes that increased mortality. Then, of course, if you are not eating well, then you end up having reduced productivity. But also, if you get sick and you're taken to the hospital, of course, you are not going to work. So that can also reduce your productivity. If productivity is reduced, then even the economic growth will be reduced. The money that you waste treating these malnutrition related conditions will increase your healthcare costs, and ultimately this can impoverish you, or it can lead to poverty because of malnutrition. So that is why we are teaching you to really pay attention to this, because what seems as a small problem can go on to lead to bigger problems like reduced economic growth, increased healthcare costs, but also poverty in the long run because of malnutrition. So it's better eat well and then prevent those negative effects. Then the other effects, especially when we look at infants, we have uh, problems of their growth and development, weakening of their immune system, and then increased susceptibility to infections and diseases. So you can remember infants that we when we talk about infants, we mean those children who are below 1 year, or those who have not yet celebrated their first birthday. So those children need to be breastfed first of all for the first 6 months, exclusively on breastfeeding, and then they can be uh, complementary feeding now, that can be brought on soft food and then breast milk. But it needs to be very well done. And when it is not done very well, these children end up having malnutrition. And when there is malnutrition, you have their growth not being proper. That is why you have some of them end up getting stunted. And then we have their immune system, especially when they lack proteins, and then when the immunity of course is affected, then that means that they'll be susceptible, or they will be vulnerable, or they will be more prone to infections and diseases. The other effect, especially when we look at adolescents, is the fact that their puberty, all those sexual characteristics, might be delayed because of not eating well. Okay, and also malnutrition can go on to affect their brain functioning or cognitive development, and it also increases their risk of developing chronic diseases later in life. And this is especially true when we are talking about uh, overnutrition. Okay, so if as an adolescent you are eating more than what is required by your body, then you can end up developing those chronic diseases later in your life, like cancer, heart disease, and then diabetes. Then the other effect, when we look at adults, those who have already passed that adolescent stage, we can have reduced muscle mass. The bone density can also be affected if you lack those essential nutrients like calcium. And then we can also have the organ functioning being compromised. Some of those organs need you to be feeding well. Okay, organs like the liver, the brain, they need you to be feeding very well. So if you are malnourished as an adult, then your organs might not function as though you were being fed well. Okay, then if you have health conditions, for example, HIV, and you're not feeding well, and as an adult, you are going to end up also being affected in a very negative way. So, if you have a disease, for example, HIV, you need to be feeding in a better way, in a good way, in an optimized way. Okay, as recommended by your your physician, because you do not want to be having some chronic disease and then do not feed well. But also remember that there are those those diseases which require some drugs that should be taken after eating. And now, if you have a situation where you're not eating well, or you're missing some meals because of not having perhaps the resources to buy them, then it will be a problem. You might miss out taking those drugs, or when you take them, you'll get those adverse effects which would be avoided if you ate better. Then the effects of malnutrition on the elderly. Uh, so these people, you realize that the elderly always have those systems that are aging. Okay, their body systems are not functioning at the same level as those of young adults or the children. Okay, so when now they also have malnutrition, or when they are not feeding well, now that the effect of their systems aging or becoming senile is greater. Okay, so this is why we are talking about things like increased frailty and vulnerability, worsening cognitive decline and dementia, or being forgetful. Then the quality of life and life expectancy. So if someone was ideally supposed to live for 80 years, and then now they develop malnutrition, or they are not feeding well, they can end up dying at an earlier stage, or at an early age than 80, which would have been their life expectancy. But even before they die, their quality of life will be very, very bad. Okay, they will have things like dementia, or that cognitive decline, being forgetful, being frail or being weak, vulnerable to these infections. And yet, if they feed well, even when they are aging and their systems are getting senile, or they are also aging, they could, if they feed well, they could survive longer and survive better. So the UNICEF has designed this framework for us to understand what could be the cause of malnutrition. Okay, why malnutrition? Why is malnutrition still a very big problem in our society? Okay, so it identifies those immediate causes of malnutrition, but from the immediate causes, we also have to appreciate that there are those underlying causes. But even the underlying causes have what we call the basic causes, or the root causes of this malnutrition. So as you can see, malnutrition per se, according to UNICEF, is caused by inadequate dietary intake, and then sometimes being diseased. So if you have a disease, sometimes could be a disease affects the way your body absorbs food, okay? Or it even affects your appetite. So you're not eating well. But it could also be that you have the appetite, you are very well, you are not diseased, or you don't have any disease, but you are not taking any food. The food maybe is not available, okay? So that inadequate dietary intake. So what could be the cause of these immediate causes? We are saying that according to UNICEF, the underlying causes of inadequate dietary intake could be that you don't have enough food in the home, but it could also be that there is inadequate care of women and children. So sometimes these groups are neglected and do not receive that food that they need. Okay, we've had people reporting that they are not allowed to take chicken or goat's meat because they are children, or because they are women. So they will not have the necessary nutrients like proteins from those foods. Okay, then also you can realize that disease can be caused by poor health services not being able to to identify people who are at risk of getting malnutrition, and then supporting them early enough. But all these come from the basic causes or the root causes, which are political, economic, and cultural factors. For example, the one that I talked about earlier of women and girls or children being denied some certain foods in some societies is a cultural factor. So for you to make sure that these people access uh, proteins from these foods, you need to make sure that you engage and modify these culture beliefs and practices. Okay, you engage the concerned people and then you modify those cultural beliefs. Of course, since they are cultural beliefs, they might take long, but it is achievable. Then economic factors, be poverty, political factors like policies that are supposed to enhance uh, availability of food, So all those come into play and lead to the big monster in the room, which is malnutrition. So the immediate causes, like I was saying, inadequate dietary intake and disease, which interact in that vicious cycle. Then the underlying causes are household food insecurity, where people lack access to safe food consistently or throughout the year. Then poor care practices and healthy environments, inadequate health services to identify and diagnose these malnutrition cases sometimes make them worse. Then the basic causes or the root causes are those socio-economic and political factors plus those cultural factors like we had said earlier on. So for you to address malnutrition, you need to understand this framework. You need to understand what could cause each one of these. You need not to look at malnutrition as a standalone problem, but it is caused by some things which are also caused by other things until you get to those root causes so as to deal with it holistically. So the socioeconomic causes or the factors that influence malnutrition, poverty, like we had said. If you do not have money, sometimes you might not access the right food that you might need, okay? Because you're not going to say that you're going to grow all the food that you need. Remember, even growing requires you to purchase some inputs, but you do not have money. It requires you to have some land. So poverty is a very, very strong factor when we talk about malnutrition. Then food insecurity. Okay, it could be as a result of poverty, but it could also be as a result of some natural calamities. Okay, if there are floods, of course, you're not going to have food throughout the year, and it will not be, uh, it might not be adequate. Okay, then lack of education sometimes. For us to understand how to eat well, we are supposed to have that information about these necessary foods or the necessary nutrients in our bodies. So we can only appreciate that if we get that information either through class like this one or through social media. So when you lack that information, when you lack that education, then there could be a problem of malnutrition. Then limited access to healthcare is also a big problem because sometimes you could control this malnutrition by detecting it at an early stage, okay, and then offering this healthcare. But if there is limited access to healthcare, maybe healthcare is too expensive to be accessed or it is too far for people to access, people might end up getting malnourished. Okay, so the double burden of malnutrition is a concept that has uh, has gained attention over the years, and it is basically the coexistence of undernutrition and being overweight or obese within individuals, households, communities, or countries. So, like we said in the second slide of this session, that we need to appreciate that sometimes you go into a community to put in place your intervention of nutrition, but you will find people who are you will find both obese people and then those uh, who are not having enough food, okay, or who are experiencing undernutrition. But you are coming to solve the problem of malnutrition. And from this class, we have realized that malnutrition is that double faceted uh, kind of problem, okay, which involves undernutrition but also overnutrition. So when you go to a community, you need to have that in mind, that I could be having people who are having overnutrition and also those under who are having undernutrition. Okay, so you need to put in place interventions that can address the two burdens. Okay, so that double burden is, of course, driven by many factors like changes in food systems, the lifestyles, and even the environments that people live in. But also, excessive consumption of energy dense, nutrient poor foods can also be a cause of this double burden. So, it poses a significant challenge for health systems and policies because to develop these programs is always a bit hard, especially in terms of gaining the necessary resources. So for you to tackle the same at the goal might be hard, but it is possible. While it presents that challenge, it is possible because, and it is possible in a way that you need to acknowledge that it is existing in the community that I'm going to, in the households that I'm going to. There could be people who are undernourished, but there could be also those who are overnourished. So you need to design your interventions to focus on both these two conditions so that you can deal with them at a go. So the interventions altogether to address malnutrition include nutrition education, so as to give people the right information to get away from malnutrition to better nutrition, and then food assistance, especially in those people who might not have the necessary the necessary food that is required for their nutrition. But also we can have micronutrient supplementation for those people or communities that are experiencing deficiency in micronutrients, therapeutic feeding programs for people with acute malnutrition or that one which is severe or moderate, but also community-based approaches to involve the community in identifying, designing, and implementing these malnutrition programs. Then, for us to make sure that we have malnutrition and is sustainable, we need a favorable environment, and that is why the sixth intervention looks at policy and advocacy for malnutrition. We need to bring everyone on board, especially those people who make the laws, okay, whether they are parliamentarians, whether they are those government agencies. They need to appreciate the cause of malnutrition and design policies and laws that make sure that malnutrition is given the attention that it deserves. So, as you can see, in nutrition education, we focus on improving the knowledge, attitudes, and practices of individuals. We need to turn them from what they know to what should be known. Okay, of course, you do not go out there and then uh, you rubbish what they know. Okay, you need to bring them to a better perspective slowly, but also empathetically. You need to show them why they should turn away from what they have been doing to a better kind of nutrition. So you do this through this nutrition education, and it can be delivered through various channels, where it is mass media like radios, TVs, newspapers. You can also use schools, very good avenues for nutrition education. When you focus or you target those students And then health facilities, whenever people come to receive these health services, there can always be those nutrition talks about how to improve their nutrition, especially for those focused clinics I've seen at a health center, which I know. When people come for the diabetes clinic, they are taught about nutrition, uh, the better nutrition options, and they are always liable to taking them on because of they do not want to suffer more from the disease that they are having. Diabetes and hypertension clinics always integrate this, but they can always, even these programs, these nutrition education programs or talks, can even extend to the outpatient department where people just come to to be diagnosed for these common conditions: flu, cough, malaria. So at every health center, we should have those nutrition education talks. Then we can have community groups or those community outreaches where we engage now the community itself, educate them about the better nutrition options. So the audiences that we target here, those that are vulnerable to getting malnutrition, and we look at the pregnant, the lactating women, all those who are breastfeeding, the children, the adolescents, and then their caregivers. So we address various topics when we are doing this nutrition education, which include breastfeeding, complementary feeding, or that feeding that takes place after that exclusive breastfeeding. And we are looking at introducing in now soft foods in addition to breast milk. That is why we are calling it complementary feeding. Then dietary diversity to increase uh, the variety of foods and diversity of the foods that people are eating so that they can gain from each nutrient group. Then hygiene is also very essential in nutrition, and then micronutrient deficiencies. So these are the topics that we always look at when we are doing nutrition education. So different methods can be used whereby we can use counseling, uh, demonstrations, games, posters, leaflets, whatever that can work in the context that you are in. So if you want to educate an individual, you can use counseling. If it is a group and it is maybe and it is at school, you can use those games, but you can also use posters, demonstrations if it is in a group setting. So these nutrition education interventions can be integrated with others. For example, if you are doing a food assistance program, or if you're providing food to these people, when they come to receive the food, before they receive it, you can give them this nutrition education talk. Okay, and then you can also integrate it with micronutrient supplementation. So the food assistance programs, like I had said, aim at increasing availability and accessibility to nutritious foods, especially for those populations who are vulnerable or prone, or they are at an increased risk of getting malnourished. So, like we had said, these vulnerable populations can include those people who are suffering from or who are from areas that have been affected by calamities, which could be natural or man-made, like floods or civil wars. So those people are liable, or they are more at risk of having malnutrition. So because they do not have access to food. So for you to increase access and availability of food, you have to do these food assistance programs. And it can be implemented in various contexts, like I've been saying, in emergencies, like in natural calamities, all these civil wars or other emergencies. Then we can also have chronic food insecurity in an area if there could be a place which has been affected in terms of their crop production and they are facing chronic food insecurity, so they have to benefit from such programs like food assistance programs. Then in transition phases, when you are trying to bring back the people or you're trying to take them from one place to another, especially in the refugee settings, then you also need to give them food. So it can provide different types of food assistance, and these include in kind food distribution, where you give food physically, but you can also give food to people through giving them cash to buy it or vouchers to buy that food. Then we can also have people working for food. So there could be various types of food assistance, and these are the ones that we have here. Then it can also target different groups of beneficiaries, such as refugees, internally displaced persons, or their host communities. Then, when you're distributing food, of course, you need to look at the people who are more vulnerable. Okay, for example, you look at factors like the poverty level, you look at the nutritional status, and other vulnerability factors, so that you can always give priority to those people who are more vulnerable than the others. For example, if you are looking at refugees and then the host community might be having their gardens, they could be having land to cultivate, so they might need food, but the refugees who are coming to their area might not have anything. So you need to target those people first before you can supply to the people who are hosting them. So of course you are not going to leave them out, but you need to make sure that you give priority to those people who are at risk of suffering this malnutrition. Then you coordinate this whole process by involving all the actors that can be of help, whether it is government agencies, NGOs, the private sector, agriculture, so that the quality of the food that you are delivering or you are using for your assistance program is good. Then the health education, education comes in to make sure that people know how to use this food, because sometimes this food might need instruction on how to prepare, on how to be served. So that's why you bring in now education. Okay. And the private sector also can come in to assist you, because sometimes your program might be overwhelmed. What you expected is less than what you find. So you need uh, assistance from maybe NGOs, the government, and even the private sector, so as to execute your food assistance program. Then micronutrition, like I was saying, focuses on those micronutrients like iron, iodine, zinc, vitamin A, folic acid, especially for the pregnant. And we say this folic acid is very essential because it helps in the development of that neural tube in the unborn child, or that spinal cord. So it is something that needs to be given to the pregnant mothers, and it is very essential. It is a very essential micronutrient, especially in the development of the unborn child. Then, so it can be, this micronutrient supplementation can be in the form of tablets, capsules, or sometimes it can be added to food that is growing in the garden, which is called fortification. And in that case, if it is added to the food that is growing and then the food grows with it. I've seen like cabbages being fortified with iodine. So you find cabbage grows and is fortified with iodine. In that case, it will be called biofortification. But also, it can be fortification in a way that processed food is enriched with these micronutrients. You've seen uh, the milk which is fortified, for example, with vitamin A. You've seen cooking oil which is fortified with vitamin E. So that fortification also does the job of micronutrient supplementation. Okay, so we target different people, of course, here, but we also focus on those who are more vulnerable, like the pregnant and lactating women, children who are under 5 years, and then the adolescents and elderly. Okay, so the different dosages depend on the type of micronutrient, how severe that the deficiency is, because if someone is diagnosed to lack iron, they are not going to receive the same dose as that one who is not yet having that deficiency. Okay, then the age, physiology, or how your body is going to process this micronutrient. It can also be evaluated when you go to the hospital. And then for us to monitor the effectiveness of